Dr. Zoref Lorenz. Thank
Hi,
you.
Deanna.
Thank you so much for taking some time to sit down today and talk a little bit more about a project that you are working on that the Histiocytosis Association is thrilled to support. And I understand the project title is Validating Novel Markers for Diagnosis and Prognostication in Adult Malignancy-Associated HLH. And this project is very important, and you gave a wonderful overview to me, but we'd love to share that with the community. Would you mind telling us a little bit more about the project and sort of its significance for research?
Yes, thank you. I'm so excited about this opportunity. So malignancy-associated HLH is a syndrome with very poor outcomes. Most of the patients that have this clinical syndrome do not survive long-term, and we do not really know what is the mechanism of the syndrome. So we conducted a very large study of the proteins of patients with hematologic malignancies, and we compared them to patients with a classical familial HLH, and we discovered that they actually share the same mechanism. And it's very valuable because now we can utilize drugs used in that disease for patients with malignancies, but we still need to validate all these findings. And this is the project, to actually validate those markers and the prognostic value of an index that we established that called the Optimized HLH Inflammatory Index, or OHI index, that can simplify the diagnosis in these patients. So the thought is that we can identify these patients and maybe even in not the so far future have adequate treatments to control their hyperinflammation. So we're very excited about this opportunity.
Yeah, thank you so much. I'm very excited about the work that you're doing. I know for those that are impacted by this malignancy-driven HLH, that the progression is so quick. And so being able to intervene and to provide appropriate therapy will definitely help save a lot of lives. So appreciate that you're focused on this, and that you're going to dive deeper to help really validate this data. And how will the funding help you it sounds like this project is close to being finished. How will the funding help?
Yes, so the funding is exactly what we need to finish doing a validation of all these proteins via ELISA, and doing flow cytometry to validate their immune activation states in patients with malignancies. So it's exactly what we needed to finish this project and publish this data and get it out.
Fantastic. Well, we're thrilled to be able to support this. Thanks to the generosity of the Histio community, and we really appreciate your work at Cincinnati Children's Hospital and everything that you're doing to help patients and families that are impacted by HLH and other histiocytic disorders. We always like to ask if you have anything that you'd like to say to the Histio community, a special message, or any words that you'd like to share.
Right. So I want to thank the generosity of all the Histio Society members, and to the family, and all the wonderful work that you're doing in the Histiocytosis Association. And we would love to engage more and to contribute more in the following years to come.
Wonderful. Well, thank you. It was wonderful to sit down with you today. And again, thank you for your heart-driven work and for the passion that you have for pursuing this. And we really look forward to hearing more about what the findings show, and how this validation of the data will help to improve outcomes for patients. So thank you so much, Dr. Zoref Lorenz. We appreciate you.
Thank you.